All right, well, hello everyone. Welcome to our Pink Table Talk. My name is Tiana Williams. I am a research patient navigator at MUSC Hollings Cancer Center down in Charleston, and I'll be the moderator this afternoon. We have two panelists here. We'll start with Ms. Cecilia Hall.
Hello, everyone. I'm Cecilia Hall, and I'm a nurse practitioner.
Hello, everyone. I'm Dr. Victoria Shedrick, and I'm a mental health therapist in private practice, owner of Key Counseling, Coaching, and Consulting. Thank you so much for having me.
All right, so we can go ahead and just jump right in. We're going to go over a little bit about some mental and physical aspects about women's health. So I'll go ahead and get started. Dr. Cedric, women often face unique mental health challenges. Can you kind of discuss some of the common mental health issues that women may experience and what factors contribute to these challenges?
Sure, that's a great question. And the challenges are common. So I want to normalize that. I think sometimes when we hear mental health, we think disease or we think illness, but sometimes a mental health challenge can just be as simple as needing to adjust to a life change, needing to adjust to a stressor. What is common among women is honestly the many roles that women play in their lives, their moms, their wives, they're, maybe caretakers for their parents. They're working really, really hard. And so learning how to have a good work-life balance might be a mental health challenge in itself, navigating what is necessary to have a good balance. Something else that comes up quite a lot in my sessions with women is grief and loneliness. The need for relationship with others, maybe they're poor, unhealthy relationships or attachments in their life. Some of the contributing factors to that could be the loss of a loved one. It could also be some traumatic experience that has occurred in their life that has contributed to them feeling grief-stricken or experiencing some other stressor. And then just in general, life changes, whether that's getting married, that's a great thing, right? We celebrate the joy of getting married, but there's that you becoming a wife, that's a life change. Same as having a baby. And there are some women who even struggle with fertility. So those are some of the common challenges that I'm seeing lately is, that this need for connection, a need to build family, a desire for those things. And if those things aren't present, then there's leads to questions of self-worth. Am I worthy enough of a relationship? Am I worthy enough of the things that I desire in my life? Wanting to excel and be successful. Also, we've got some wonderful boss chicks out there that are doing it all. And a lot of times they're comparing themselves to other women. And they see other women on social media doing it and they think, well, gosh, they're doing it really well. I want to do, I have a desire to do those things. And so you get stressed and overwhelmed, sometimes comparing yourself to others. And that can bring about, I wouldn't say unnecessary stress, but it is in a way comparing yourself. But that's something we often do. So those are some things I feel in general that are contributing to some of the things that women are dealing with right now. Work-life balance, grief, loneliness, relationship issues, past traumas that are unhealed and unresolved, and just learning how to navigate major life challenges.
So much, Dr. Cedric. You brought up some great points about women wearing multiple hats and the pressure and all that comes with it. All right, so Cecilia, can you provide an overview of the most common women's health issues and what are the key factors contributing to these concerns?
So, an overview of the most common women's health issues. Just starting off, number one, the biggest common issue for women's health is heart disease. We know breast cancer and diabetes, depression and anxiety. And also one you may not think of is pelvic health. Pelvic health is one of a really big after menopause. We see a lot of changes with, things such as pelvic organ prolapse, pelvic pain, things such as chronic bladder pain syndrome, urinary incontinence, different types. There are different types, and we'll get into that a little bit later on the segment. But some of the things that are contributing to that, the top one is being overweight or obesity. Those will contribute a lot with diabetes, heart disease. even breast cancer. And then the biggest one is hypertension. So that is a very common issue, and hypertension now is leading to heart failure, stroke, heart attacks, and chronic kidney disease. So hypertension is one of those ones that are silent killer of the kidneys. I mean, that's causing a lot of chronic kidney disease. So that's just some of the overview of the common women's health issues. There's some others, but these are top on the list that you often hear and where we focus on the most.
Thank you so much for sharing that, Cecilia. So Dr. Cedric, how does gender and societal expectations impact women's mental health, and what role does empowerment play in fostering better mental well-being for women?
So that is a really good question. I don't know if you guys heard it, I'll repeat it. She's asking about societal pressures and expectations that are placed upon women nowadays and how that impacts our mental health. It's a great question because we know that, we women have experienced these societal pressures for generations, right? Pressures to be, to be a wife, to be a mother, just that in itself, and the many roles that we play in our lives. And I mentioned earlier about comparison. And now more than ever, because of social media, we're able to compare and see what everybody else is doing. And we're not running our own race when we do that, by the way. And so from an empowerment standpoint, one of the things that I encourage women to do is to think about, don't be concerned about what others expect and run your own race. Pave your own way. And it doesn't have to look like anybody else's. You know what I mean? I have worked with 28-year-old millennials, and they're stressed out, overwhelmed. You want to know why? They're worried about turning 30 and they're not married yet. Yeah. And here I am. I'm bold and proud with mine. I'm 44, unmarried, no children. That is my choice. You can live your life a different way. You don't have to live it the way mama lived it, grandma lived it, or who your best friend is. And so these young people are seeing that, well, my friends are getting married and I'm not even in a relationship and I'm about to turn 30. And I'm thinking, honey, you gotta live your best life. You are in the prime of your life. I'm like, when I was in my 20s, I was like traveling and doing things. So it doesn't have to look a certain way. That's the empowerment piece. I empower women to let them know your life does not have to look like anybody else's. Make it your own. Do what is best for you, and stand in your own power and your own truth. And what works for everyone else, it's not gonna work for me. I'm happy for everybody. Great. You like what there's an expression, you like it, I love it.
Yeah.
You like it, I love it. But I'm over here, I'm gonna do this, and I'm just fine with that. So learning to be content with where you are, I think, is very, very important when it comes to comparing yourself and looking at the pressures that are placed upon women in society.
Thank you. You are absolutely right. I kind of took away from that. When you're looking at your wedding, I'm always putting pressure on myself to be this way, this time point. You made some good points. It's always really pressure on women.
Yeah.
But Cecilia, so what are some ways that women can prevent and do lifestyle changes to kind of rectify some of the chronic health illnesses you mentioned earlier?
So, first to start off with, top one is establish a primary health care provider. You need a primary care provider. Oftentimes, folks are not seeing their practitioners. They have to go in and see a doctor. So that's number one. That's just a preventative measures because you're going to get your preventative screenings. And so those are the things and how you can get ahead of the game. All right. And so maintaining a balanced diet. That is in moderation. We know the things that, decreasing our salt intake, low cholesterol diets, not saturated, a lot of saturated fats, but we can do all of this in moderation. You want to decrease your simple sugars. If you're a soda drinker, tea drinker, start by eliminating some of those things, avoiding or decreasing them. If you don't want to cut it all off, you can start by decreasing them, and small changes lead up to the big changes. Walking, simple as that. If you have limitations with your knees or your legs or something like that, you can start with something as simple as walking 20 to 30 minutes a day. And then, recommendations state that you should at least do activity with moderate intensity 3 to 5 times a week. And that could be in the form of aerobics, that could be power walking, a lot of different exercises out there that you could do that can lead with more moderate intensity, kind of work up a little bit of sweat. When it comes to, alcohol or drinking, with women, they recommend that you do less than 1 a day. You can avoid it at all costs, just don't even drink. So that's even great and preventative. Prioritizing sleep. That's a lot of that in day to day. Most people are, I'll say younger and not retired, are living, busy lives. Work-life balance. A lot of us are not getting our recommended sleep of 7 to 8 hours. That's what we recommend. But that, if you think about average day to day, most people are getting probably anywhere from 4 to 6. So definitely working on your sleep. The other thing would be reducing stress. That's a big one. So we know a lot of stress, and Dr. Shedrick mentioned about those factors in comparison and all these things that adds to the stress level. And a lot of times people will hold on to stress. So you got to learn to do things that will reduce that stress. A lot of activities, self-care, read a book, go walking, exercise, a lot of things that can take your mind off those, type things. Also, another preventative measure is making sure that you take a daily multivitamin. Taking vitamin D helps bone health, your immune system. So with vitamin D, a lot of our African-American women, they're low in vitamin D. We don't get a lot of the sun. We're melanated, so we miss a little bit of that. So vitamin D is really important, especially going into the cold months, the winter months. A lot of depression kicks in, things like that, seasonal depression. Vitamin D is a very good supplement for that. So those are some of the things that we can do, preventively.
Thank you so much. You made many, many great points. And emphasize the vitamin D. Go get yours checked.
Yes.
Yeah.
I literally had mine was like 12, but it's supposed to be 25 and above.
Yeah.
Wondering why I was so tired all the time, and that was one of the main causes. So got on a good vitamin D supplement, and my whole life changed. Well, for the most part. But yes, still stressed, but it does make a big impact. So, Dr. Shedrick, the concept of self-care is often discussed. What does self-care mean in the context of women's mental health, and how can women prioritize it in their lives?
I'm seeing a lot of self-care products here. I'm here for that massage chair. I'm coming for you after this table talk, by the way. But I always tell clients, self-care, it is so much more than bubble baths and candles, even though those are wonderful ways to, relax and pamper yourself. I think the thing that I hear most often when I ask women, what do you do for self-care? A lot of times there's this silent pause of like, oh, I don't know, like, what is that? And then they'll say, well, I get my nails done. I'll go to the nail salon and get my nails done. And, I get my hair done. That's great. That's maintenance. We do those things to look good on the outside. But self-care is also about the inside. What good is it for me to have my nails done, my hair done, my face beat, my lashes done, my brows done, if I'm broken on the inside? If I have not tended to my emotional health, my spiritual well-being. So it's so much more. It's setting boundaries in relationships. It's saying no to toxic relationships.
Yeah.
It is surrounding yourself with good people and being in good company. And it is also doing a lot of the things that Cecilia mentioned, those basic things to take care of your body. Making sure you're hydrated, making sure you're resting, you're eating, taking care of your body. You're going to medical appointments. That might include also seeing a therapist if needed. So self-care it's a trendy word, and we like to talk about it like it's, it's lavish and luxury. There's no luxury behind it. You don't need a lot of money to take care of yourself. What you do have to have is some self-love and a bit of discipline to make sure you're making good, healthy choices.
Mm-hmm.
And that includes who's in your circle, who you talk to, what you consume, what you read, how much news. Are you watching too much news? Maybe a good self-care practice might be to disconnect. A good self-care practice could also mean limiting your time on social media so that you're not getting caught in that practice of comparing yourself, taking a detox, having quiet time, and engaging in an activity that is just for enjoyment. I ask so many women all the time, what do you enjoy? And they pause and they say, I don't know. And I'm thinking, and I'll ask, well, what's the last time you've done something just for you? And again, that pause, because as women, we are accustomed to doing for everyone else and giving and being a caretaker, that we don't pause and really, do something for ourselves. The simple things, just sitting outside in nature, having quiet time. So a lot of times I'll tell my clients, you know what, for homework, I want you to have a selfish moment. I'll give that as a homework assignment, especially for those women that are always moving and doing for everybody else. Take a selfish moment. Do something just for you once a week, if you can do that. And so those kinds of things. And here's the thing. You want to prioritize that, because if I'm not good to myself, I'm not good for anyone else. That is why it is so critical. And we are oftentimes pouring from an empty cup when we first got to start with us. So I hope that helps.
Yeah. Thank you so much, Dr. Cedric, for shedding light on those issues. Before we go into our next topic, I'm just going to talk a little bit about how what both of them have said is that you have to give yourself, like getting screened regularly for things and just taking charge of your overall health matters. South Carolina has a lot of different disparities for several chronic diseases. So we kind of fall behind when it comes to basic screenings, like not just like cancer, but like getting your A1C checked, getting your kidney function checked. And then here we are populating most dialysis centers. We're also populating people getting insulin all the time. Like, it's just beyond measures how badly our health is sometimes in South Carolina, just we don't take care of ourselves or take the initiative to go be seen by providers, ask your provider questions, things of that nature. That all contributes into prevention for any chronic health disease. So with that being said, Celia, can you kind of talk about how important it is to get regular health screenings for women, and what are recommended health checkups and screenings for various age groups?
Yeah, so we'll start with what we mentioned before, high blood pressure screenings. So for hypertension, you should at least have a blood pressure screening starting at the age of 18. And so when adults that are 40 years and older, if they already have the risk factors, if you're African American, if you're obese, or you have a high to a normal blood pressure, you should have your blood pressure checked yearly, just in your regular checkups. And then when it comes to whether your baselines are, depending on what your blood pressure is, that would depend on, your course of treatment, but at least having that check. Often people go in and they've never really had a true blood pressure check, and their blood pressure is through the roof. So we don't know how long they've been walking around with that blood pressure at that level. And sometimes people are coming in at stroke level on their blood pressures. And they have no idea because they were not checking their blood pressures. It used to be a time when you could go in and you could go get your blood pressure checked. And there are some areas that still can do that, but we now incorporated a lot of the clinics with the practitioners in them, like minute clinics and those kind of things. But you used to go in the stores and the drugstores and just go get your blood pressure checked. But I encourage anyone, and these are guideline recommendations, you start with a screening at the age of 18. And then you move on 40 years and older, you need to be getting it screened every year, okay, with your healthcare provider. And diabetes screening. So if you're seeing a practitioner, you're seeing a regular healthcare provider, they're going to be doing blood work on you. A diabetes screening, do you want to start anywhere from the ages of 35 to 70? That's for asymptomatic. That asymptomatic means you're not having any symptoms that would be classic for diabetes. Something's changing, maybe you're urinating a lot, maybe you're starting to get shaky, different things. That will be someone that's symptomatic and you may have to get screened earlier. Your healthcare provider may check you on that based on how you come in and what symptoms you complain of. But just routine recommended guidelines, 35 to ages 70, you'll want to at least be screened. And they do screenings by blood work. She mentioned the hemoglobin A1C. That's the most popular one that's done by the blood work. And that's going to tell how your blood sugars have been running over a course of 3 months. So the doctors can kind of tell if, your sugars have not been steady. And you might have some spikes at different times, and they can get a good picture of what that is. And there's ranges. I won't get into all the ranges, but there's details whether you're not diabetic, pre-diabetic, and whether or not you meet that threshold to be a type 2, have type 2 diabetes. The other screening, your colorectal screenings, those as the colonoscopy. So the colonoscopy starts at the age of 50, anywhere 50 to 75. Now, typical colonoscopies are every 10 years. But it's based off of your screening. There are some new screenings now where you don't even have to do the full colonoscopy. You're taking a pill and swallowing it. It takes pictures. They even have one. Yeah, they have a lot of different screenings. So talk to your healthcare provider. It's not always about going through that one that we know about and we hear about, and that dreaded prep that you have to do that everybody knows about. But there's a lot of different ones, and just talking to your healthcare provider, they'll steer you in that direction of what's best based off of what's going on, your risk factors and so forth on the best one. And then the big one for our ladies, cervical cancer screening. So ladies aged 21 to 65, the new guidelines are that you have a pelvic exam and pap smear every 3 years. That may change based off of if you've had an abnormal pap smear. Your recommendations on how often you should get it, that may change, but that's different, for everybody, just depending. But those are just the U.S. Preventative Service Task Force. These are the general recommendations that we have, but of course those things can change. Our ladies 65 years and older, osteoporosis screening. Your doctors will screen you based off of after menopause. Some ladies that are younger than age 65, if they got kind of put into menopause earlier based off they had a hysterectomy. Those are things that where you may be losing the estrogen there, in the bones. So your screening may come earlier than 65. But those are really important screenings. Depression screening. So that's Dr. Shedrick's area, but your healthcare provider, their tools that they do, their screening guides that they'll give you to determine any adult population, pregnant ladies, postpartum ladies, those are, and older adults, because those are the bigger areas where depression and anxiety really come in the forefront. And then there's the HIV screening, ladies 15 years old. The recommendations as young as 15 now, to 65 years of age for HIV screenings. So those are just routine, yes, and this is by the U.S. Preventative Service Task Force. So those are more common recommendations. There are some others, but those are the most common screenings that we are doing now in your healthcare provider's office.
Thank you so much, Cecilia. Dr. Cedric, so hormonal changes such as going through pregnancy, cancer, menopause can affect a woman's mental health. Can you just discuss the emotional aspect of these life stages and strategies for managing them?
I love that this question comes up because we understand there's a relationship between our physical health and our mental health. And I'm just so glad to hear everything that Cecilia is sharing, but everything that affects the body also affects the mind. And so it's going to have an impact upon you. So when we talk about life-changing health events that have occurred, whether planned or unplanned, it can have an effect on us. pregnancy, for instance, and there's, obviously it depends on the individual and their pathway to pregnancy, whether it was planned, unplanned, whether they've had previous miscarriages and there have been some fertility issues. If that's the case, obviously there's a lot of anxiety around that pregnancy. As happy as they are to get the news that they're pregnant, they've struggled to get to that point. There's some anxiety about now, how far along they're going to be able to make it, I also, obviously with pregnancy, there are hormonal changes, things that are going to affect your mood, but also just the idea of your life being significantly is changing, right? Especially if you're becoming a new mom. And I'll share this. I have a niece, she's 28. She just had her first baby 2 weeks ago. And I had a beautiful opportunity to observe her going through pregnancy. And she literally went through all of the signs of grief while pregnant. And you wouldn't think that, right? You think of grief, you think of the loss, but she was grieving her former self. She was grieving her dreams and her ambitions. It was an unplanned pregnancy, but she called me one day crying and she said, I just didn't want this for myself at this age. I'm supposed to be in school. I'm supposed to be working on my career. She just got back in school. So sometimes, even though, whether it's a positive thing, like, the blessing of a baby, it still brings up some emotional things that make you grieve that former self. Because now, life is going to be much different. Obviously, she's got a new baby now. And of course, now I'm seeing signs of postpartum in her. And she thankfully was working with a therapist already. And that was something that they were able to discuss and have a plan for. So that after she had the baby, there was a plan for how she was going to manage her emotions, even if that meant going on medication, seeing a psychiatrist. And those are things that are okay, even in the short term. So other changes, when you get, whether it's life-threatening or non-life-threatening, any diagnosis, again, that can bring up a lot of anxiety and fear. Something we don't like to talk a lot about in society is death and dying. And then that's something that comes up oftentimes, particularly individuals that are diagnosed with, something life-threatening. Now, I had a client who was diagnosed, with, stage 3 breast cancer, and she had it before and she beat it, But then, one thing I've learned with cancer survivors, even though, there's this part of you that it's behind you, there's always that thought, it's like a shadow following you, like it could come back at any time. And so she would literally get triggered, just going to the doctor, afraid of what they might find. And so that's how it affects your mental health, even just that. And so she got diagnosed with it again. And so that brought up, again, those same feelings and fears, even a rejection of your body. I know from women who experience life, like physical changes to their body due to cancer, whether it's, having their breast removed. Think about how that affects your self-esteem, your self-worth, your identity as a woman. So those are some things that typically come up as we talk about mental health challenges. With menopause, it's again another stage of life. And it's not only are you going through the hormonal process, everybody, of course, talks about the hot flashes and the, the symptoms that they're experiencing. And it's not fun, it's not pleasant. But even with that, on an emotional level, there's this process of grieving former self, the idea of aging. I'm getting older. I'm not as young as I used to be. My body is changing. Things are happening here. Getting out of bed, I'm feeling some sores and, I'm having to shake it out a little bit, So any type of physical or medical change or diagnosis is absolutely going to affect your mental health because we need our body. And when our bodies are failing us in some way or changing, or it is going to affect how it changes our life, there's a lot of anxiety that comes with that. And oftentimes even depressive feelings and thoughts can come from that. So the way you manage it, I say this all the time. My favorite word, by the way, is grace. You have to manage it and you have to give yourself grace. If whether you're experiencing a high-risk pregnancy, whether you're dealing with fertility issues, going through menopause, you've received this cancer diagnosis, treat yourself with kindness, treat yourself well, give yourself grace, give yourself permission to feel what you need to feel in the moment, and be okay even when you're not okay. Know that it's okay to not be okay, and to have an awesome support system. One of the things I did with my niece when she told me she was pregnant, I said, this is what we've got to do. We got to first identify your village. Let's go ahead and identify right now who is a part of your support system. And I recommend that for anyone that's going through any life-changing medical situation or change. Go ahead and identify your support system. When you identify who those individuals are that are a part of your village, then you've got to be able to communicate to them what you need. Because people don't know how to help you. They don't even know what to say sometimes. But you have to communicate what you want, what you need from those individuals in your life. So I strongly support that. Utilizing your faith. Obviously, if you are someone of faith, that is the biggest coping skill there is. So definitely taking advantage of those sort of resources to manage any of these changes is recommended.
Thank you, Dr. Cedric. You gave some amazing and eye-opening advice about going through these mental health challenges with physical health issues. So Cecilia, earlier you talked a little bit about pelvic health and women's pelvic health. Can you kind of talk more about some of the common pelvic health issues and how we can kind of maintain or improve them as women?
Yeah, so common pelvic health issues that we, you may have experienced some yourself, but what we see a high incident in women, one being recurrent UTIs. We see a lot of chronic bladder pain syndrome and the urinary incontinence. And so that's often one that's most common as we get older. A lot of ladies are, they have a little bit of what we call stress incontinence. That's when you laugh, cough, and you sneeze. You have a little bladder leakage. And then there's, urge incontinence, where if you have the urge to go to the bathroom really, really bad, you may have bladder leakage. Now, this is something that a lot of ladies may talk to their providers about. A lot of them don't like to talk to their providers about it. But a lot of times it's your provider, they may not be comfortable sharing that if they have a male provider or, and not a female provider. However, ladies, there is help for your pelvic health. A lot of ladies deal with pelvic organ prolapse. That's another thing. And when I say that, that means like bladder, you hear your bladder prolapsing or dropping. And that can come from having big babies. A lot of things, just pelvic floor laxity. Those are some really, really common issues that we deal with every day in the office settings. We see patients all the time that come in and they have those little complaints. Overactive bladder is a term that you may hear a lot. Those encompass the urge and the stress incontinence. It's like a kind of an umbrella. So the urgency frequency syndrome, I'm going to the bathroom a lot more. I mean, you're going more than 7 times a day, anywhere. Some people are going 10 and 12 and 15 times a day. That's a little bit excessive. So those are the things that, you want to speak with your healthcare provider about. Just some things to manage your pelvic health to start with are just healthy bladder habits. So you want to just be drinking water, an average of 4 to 6 glasses a day. You also want to be evacuating your bowels daily. A lot of people don't realize how constipation plays a role in the way that you empty your bladder. You don't think about it, but your colon sits right on top of your bladder. You have a piece of colon going across there. So if you're not evacuating your bladder and your bowels, daily or every other day, then you probably have a sluggish bowel. So it's really important that you are having adequate bowel movements. Being constipated can increase your urgency to go to the bathroom. So those are things that you can do preventively to maintain your pelvic health. You also want to be using the bathroom when you're urinating every 3 to 4 hours. You need to not hold the bladder as long. Now, I will tell you, because I am one of those persons, and when you're in the nursing or healthcare jobs such as teachers, we are usually professions that hold our bladders for long periods of time. Well, I am here to tell you that in the long run, it will affect you. Holding your bladder is very long time is not helpful. You're actually stretching that bladder out. So your bladder gets a little weaker, and then over time when you're holding a lot. So when a woman can hold a certain amount, a man holds a little bit more in their bladder, but you should be finding that your bladder is on a routine schedule of emptying when you can. And I get it, those professions that you have to hold it, but it does play a role in how your bladder symptoms can start later in life. You start having a lot of complaints of not being able to hold the bladder due to that. And menopause plays a big role also in the health of just the pelvis in general. Because after menopause, there's a lot of things that starts to happen in the pelvic floor area. So for the ladies, the pH changes in the vaginal area. Then that estrogen leaves the vaginal area, and those tissues start to get a little thinner. They start to shrink a little bit, and they're not well estrogenized. So those can lead to a lot of the urgency to pee, the feeling that you have to pee all the time. It can lead to vaginal irritation. All of those things are what we call, is actually a syndrome. It's called syndrome of menopause. It's actually GU syndrome of menopause, because that means it's dealing with your genitourinary area. So that's dealing with your pelvic floor. A lot of muscles, the pelvic floor, the muscles go lax. So there's a lot of things that cause stress incontinence. When you laugh, cough, and sneeze, you go exercise, you jump up and down, you leak a little bit. So we know that the basic things you can do for that type of incontinence is start doing bladder exercises, such as, like, you've heard of the Kegels. So that's tightening that pelvic floor. That's something that you can do, just nobody don't even know you're doing it. You're just squeezing and tightening your pelvic floor. That's a start. But I would recommend that you do see, if you have that complaint, to your healthcare provider. There are specialists in this area. You want to see a urologist or a urogynecologist, because a urogynecologist is going to focus more on the pelvic health. And there's a lot of things and a lot of ways that we can check you, starting off with just a simple pelvic exam. So I encourage my ladies that if they do have any issues with that, there's help. You do not have to say, well, it's because I'm older, so I'm expected to leak a little bit of urine. It is things that we can do in ways that we can help, you live a better quality of life. It's definitely if those symptoms are bothersome to you. So I would urge you to see your healthcare provider. They can always refer you to a specialist in that area that can help you with it. And also pelvic pain, that can become chronic for various reasons. There's a chronic bladder pain syndrome. Some things called interstitial cystitis, where your bladder is just always inflamed. We see a lot of that as well. And if you go to, like, a urogynecologist, they can direct their therapies by doing a pelvic exam, and then they'll direct their therapy and their plan of care for you. So I advise you to, mention this to your provider if you're having any issues in that area. But those are just some of the common things that we see a lot of when it comes to the pelvic health.
Thank you so much, Cecilia. That was a lot of great information. Something I didn't even know about. So that's good that we're all learning. We're going to transition a little bit into breast health. So before we do, I just want to give a few statistics on breast cancer in general. So 1 in 8 women will be diagnosed with breast cancer in their lifetime in the US. In that same setting, 1 in 800 men will be diagnosed with breast cancer in their lifetime. I feel like sometimes we forget that men also get breast cancer. Obviously, 1 in 8 and 1 in 800 are completely different, but it's still possible. And then we're looking at certain groups of women. Minority women have not the best statistics with breast cancer. So for example, African-American women and Alaskan Native and American Indians, they have a lower incidence rate for breast cancer than non-Hispanic white women. However, their mortality rate is much higher than any other group for breast cancer. And that's with usually any type of breast cancer. And then speaking with Black women specifically, we are more likely to be diagnosed with triple negative breast cancer. It is considered more aggressive because you are negative for all hormone receptors and certain proteins. So your treatment options are limited. Like if your doctor wants to do what's called a HER2 targeted therapy, but you're HER2 negative, like there goes your window for that certain therapy to treat your cancer. So that kind of contributes to how we have a high mortality rate with Black women and triple negative breast cancer. And then another fact that's like really alarming in my opinion is that at any age, we think of breast cancer, oh, you're 50 and older or 40 and older. No, I've seen women, I work with our breast team sometimes on clinical trials, and there's women on the tumor board that are in their 20s. So it can happen at any age, but at any age, a Black woman is more likely to die from breast cancer than a white woman. So let's say we have a white non-Hispanic woman that is 55 diagnosed with breast cancer, and we have a 38-year-old Black woman diagnosed with like breast cancer. She is more likely to die than that white woman that is older than her. So while these statistics are alarming, I will say overall, given from like, let's say the 1980s to now, breast cancer trends have decreased in mortality. However, if you just look at a graph or mortality for Black women, we're at the top. Every single type of breast cancer, we're at the top. So that's why breast health is so important for minority women, because you have to fight it. You have to be in front of it, because statistically speaking, your odds are not the best compared to like our counterparts. So with that being said, Cecilia, will you kind of go into how breast health is critical for women, and what advice do you have for them regarding breast self-exams, mammograms, and early detection for breast cancer?
So breast self exams, the best time, that's generally where you can start just for yourself. Of course, you have a healthcare provider that's going to do screenings on you, but breast self exams, the best time to perform your own check is once a month, and you want to do it about 3 to 5 days, ladies, after your cycle starts. And you want to check your breast for any lumps, abnormalities. You also want to take a look at yourself, like get in a mirror, and you want to, place your hands on your hips and look at the symmetry of your breast. Make sure that you don't see any abnormalities, any dimpling, any changes in your skin, any discharge coming from your nipples. That's where you want to start, just breast self exams in itself. And you want to have a clinical breast exam every 1 to 3 years for women aged 25 to 39. And when I say clinical, that just means in the clinic seeing your healthcare provider. They want to do an actual hands-on exam. Okay, you want to begin that at age 40. The U.S. Preventative Task Force, they recommend you start. That's when you start breast cancer screening. But as Tim said, you don't. Everybody is different, so it's going to be based off of your risk factors, your family history. You may start that screening way earlier. And as some of you in the room, if you have a family member, a first-degree relative that had breast cancer, you may start your screenings at 30. I know I did. My mom is a survivor, and I started my breast cancer screenings at the age of 30. And it all depends if you, depending on when your degree relative, your first degree relative, was diagnosed with their breast cancer. So some of the screenings will start a little earlier than 40. These are just the recommended age to start your screening at if you don't have any risk factors. And so where ages women 40 to 49-year-old, you want to go with your healthcare provider and let them determine based when you should start your screening for your mammograms. And also women ages 50 to 74, if you're at an average risk for breast cancer, then they recommend that you get a mammogram every 2 years. But again, just, you want to see your healthcare provider, and they can determine that by gaining a great history from you and knowing whether you're, if you have any high risk factors.
Thank you so much, Cecilia. I want to plug in to please advocate for yourself, especially if you are in that range that's younger. I will share my personal story. I was still an undergrad here at USC before I went to graduate school, and I had some breast concerns, and obviously they would not do mammogram on me because I was in my early 20s and my breasts were very dense, but I was like, someone's gonna do something because I'm not gonna sit here and be stressed out and be worried about, do I have breast cancer? I'm also adopted, so I did know my family history. I was like, someone really does need to do something. So I ended up getting a breast ultrasound instead. Nothing was found, but it gave me peace of mind. that some type of screening were done. So if you are younger and you have like maybe lumpier breast and maybe fibrocystic breast, please go get like a breast ultrasound or get your clinical exams more often. And if you are heavier chested, I've been told by my primary care, I could do my self exams, but it is better for me to get more regular clinical exams if need be, because it's hard if your breasts are larger and you can't really palpitate all the way around by yourself. And then also with that, when you obviously early detection is the key, but even if you do get diagnosed, a lot of people, I feel like, especially women, kind of lose hope because they see breast cancer as a death sentence. Before becoming a patient navigator, I was a clinical research coordinator with clinical trials at Hollings, and I've seen a lot of the work that comes from clinical research. Unfortunately, minority women, especially Black women, are not really represented in U.S. clinical trials or international trials for that matter. So the therapies we have today are based off of statistics for non-Hispanic white women. So in reality, or statistically speaking, they will probably benefit from these therapies more than the women the breast cancer is affecting more. So that's just a little plug for me that if you do get diagnosed, talk about all your care options. I feel like people think cancer, chemo. No, you can get radiation therapy, surgery, immunotherapy, ask about a clinical trial. Like I said earlier, triple negative breast cancer has high mortality rates in Black women. A lot of the phase 1 trials, which means they're first in human and investigational agents, that might seem scary, but almost every chemotherapy drug was phase 1 at some point that someone receives during breast cancer. Please make sure that you ask your provider, what are all my treatment options? And I will say Hollings is located based in Charleston, but we do have a grant with the NCI where we have clinical trial options at MUSC Columbia or MUSC Lancaster, Florence. There might not be our phase 1 trials, but they are still an option to be incorporated with research so we can kind of cut back on the disparities we see in minority women in breast cancer. Also, I'll still be here after a little bit if you want to talk more about clinical trials. I do have some brochures in respect to like prevention, screening, and diagnosis for breast cancer. So, Dr. Cedric, stress is a common issue for many women. What are some effective stress management techniques that women can incorporate into their daily lives?
Stress is inevitable, right? We can't avoid it. It's going to happen, and it's a natural part of life. But what we can control is how we respond to stress and the stressors in our life. And I think the biggest thing I can suggest and recommend as it relates to stress is to listen to your body. Your body will tell you exactly what it is feeling and also what it needs. A lot of times when I'm in session with clients, I do a lot of body work. I do a lot of breath work in my sessions with clients so that they can connect with our bodies because we're so busy, right? And we're so busy on, sort of almost on autopilot. We're just kind of running and doing all the things that we really don't do a really good job of checking in with ourselves. And so I always recommend routine self-check-ins throughout the day. And that just simply looks like you've taken a moment, even if you're at work, and just sitting for a moment, taking some deep cleansing breaths and identifying how am I feeling in this moment. Then the next question you want to ask yourself is, what do I need? That's something very easy that you can do. And when we are intentional about sitting with ourselves, and especially listening to our bodies, we can actually do a body scan. I like to do those with clients, where you basically imagine you're scanning your body from the top of your head all the way down to your feet. And if I'm honest, I'm feeling some tension in my back right now. So my body's talking to me, even right now as I'm standing here. And so you think, well, what is my body telling me? Well, my body's telling me I probably need to stretch, right? Sometimes the body is telling you, you need to rest. It's telling you to slow down. It's telling you to say, no, I'm not going to do that, right? Because we oftentimes bring stress upon ourselves by saying yes far too often. Who's guilty of that? Yeah. And we're fight it. It's like we're like stress magnets. We're like, I'll do it. Yeah, sign me up. Yeah. And then you're like, oh my God, how am I gonna get this done? Right. So listening to the body. But the next thing I would say is to avoid how to avoid unnecessary stressors being placed upon you is, and this is something I literally had to do when Lexia asked if I would do this. And this is how I do with anything. If I'm asked to do something, before I make a commitment on obligation, I always ask myself first, one, do I have the time to do it? Two, am I in the mental space to do it? Three, what is required? And do I have the resources that are required to do it? If there's, I don't know if it's a financial thing, like finances to do it, whatever it is. But I go through a mental checklist. So when she asked if I would do this, and I think I told her, I said, I'm in the middle of moving, but we make time for the things we really want. And so I said, I can make that happen. Number one, I love to talk. This is what I love to do. I don't know if y'all noticed that. I love it. I'm living my best life right now. So I'm like, I love that. And I would love to do it. And I was like, wait, make sure you got the time. Do you have the energy? I said, yeah. And then, does it align with your values and what you want to do? Because a lot of times we're saying yes to the wrong things, and then we get stressed and overwhelmed. I'm not experiencing, listen, I feel like I'm in church over here. Some amens over here. But I make sure before I commit to anything that it aligns with what I feel is purposeful and meaningful to me. So when she asked me what I do, I said, yes, I want to come. Yes, I love it. I love this. I love being in this space. I love talking to women. I like talking about mental health. So this is not causing me any stress at all to do this. Think about your life, the things that you have going on, and the ways that you can even avoid stress by just going down that list. Do I have the time? Do I have the mental energy and the capacity to do it? What resources are required to do this thing? Do I have that? And is this something I want to do, and does it align with my values and my purpose? I think that's a great way to minimize stress. I hope y'all will try it.
Yeah. Thank you. I'll be trying that as soon as I leave. Yeah, that was such great information as you have given the whole time. So for both of you, what are some resources and organizations that women can turn to for both mental and physical health challenges they are facing? I'll start with you, Cecilia.
So I would say just resources to start off. You want to just make sure that with things such as like specialists, you can just women, you can go to women's health clinics. People that are specializing specifically in women's health. You can actually go to your gynecologist, and this is where it's dealing with your pelvic health. There's so many different specialties. There's just not one provider that will encompass everything. Sometimes you have to branch out into those specialists. Looking into the American Heart Association and the Go Red initiative, those things are good resources to look at for the heart disease. Also, CDC can be really informative on a lot of health statistics and things for women. But yeah, cardiologists, use your specialists, your healthcare providers. They're great resources. Your providers we do guideline care, evidence-based practice. So you wanna start there as your resources, and based off of what's going on with you, they will direct you to a specialist if needed, and someone that actually specializes in a certain level that can get a little bit more advanced in your care.
Yes. So if you're seeking mental health resources, you don't have to look far, honestly. And I like that Cecilia mentioned, checking with your physicians, because oftentimes that's a good starting place. when I started out in private practice, most of my referrals were coming from doctors because, as she mentioned, they will actually do a depressive screening. They can do anxiety screening. Some of them have social workers to kind of do some preliminary screenings. And then that's when they'll say, hey, are you talking to a therapist? I think, I noticed your blood pressure has been really high and you seem, might be a little anxious, got a lot going on. Let me refer you to a therapist. So start with your doctor. They are a great resource to refer to someone that particularly might be in your network if you utilize an insurance, and that's really important. Also, you can find your own therapist. There are several directories where you can do a search. It's kind of like a dating app in a way, Psychology Today is one of them. Therapy for Black Girls is another, if you're looking for a therapist of color. But you can go to these directories online, do a search for a therapist based on your specific needs, based on what insurance you have, based on their specializations, where they're located, whether you want virtual or in person, and you can narrow it down, and then it just shows you a whole list. And then from there, you're actually reading their profile. You can see their picture. You can go to their website, do some research, and even talk to some folks who've gone to therapy. And sometimes word of mouth is the best way. You'll be amazed that, people that you might work with or friends, they may be, talking to a therapist and can recommend someone to you. Also, something that a lot of people don't know is that their jobs have EAP programs. How many of you are familiar with EAP, employee assistance programs? And when I started my practice, that was something that I did also. I was on an EAP panel. So what that does is allow you to get free therapy services that are paid for by your employer. And something else, if you are a veteran, if you have, whether you've been active or retired vet, you can receive free therapy through the VA. Not just at the VA, but with a private therapist. I have a contract with the VA hospital. Actually, those are some of the best clients. I absolutely love working with my women veterans, but the VA will refer clients to me and they will pay for the therapy. So a lot of people don't know those things. You can get free therapy. Voc Rehab is another organization. If you are someone who has a disability, Voc Rehab will pay for therapy. There is a program called the Loveland Foundation, and it is, devoted to making sure that marginalized populations have financial access to therapy. So you can just simply go to their website, fill out a brief form, and you may get approved and get vouchers for about 4 to 6 sessions. Again, free of charge. So I want to say this as we conclude. A lot of times we make excuses for doing things that we know we need to do for ourselves. Money should not be one of them. Money should not be one of them. There are a ton of resources to support you in your mental health. There are even therapists that are willing to meet you where you are financially. If they do not take your insurance, they're willing to offer a sliding scale fee rate, which is something that I do to meet clients where they are. So please do not let finances be a barrier. Do not let other people be a barrier. The stigma of it all right now, if it's something that you need, make it a priority, just like we do with everything else. We make the hair appointment, we make the nail appointment, we do the whatever, all the things, but you've got to make, just as you are making your physical health a priority and making doctor's appointments, also make sure you're okay mentally. And there's nothing wrong with sitting down and talking with a therapist and getting some tools. Doesn't necessarily mean there's anything wrong with you. Doesn't mean you're crazy. Doesn't even mean you have a diagnosis. Quite frankly, a lot of the women I work with don't even have diagnoses. They are just going through life and experiencing some stress and some struggles, and I'm there to help them along the way and to hold space for them in a safe, non-judgmental environment. You're not judged. You just have that person that can listen to you and walk with you in your journey. So I hope you guys, if you are standing in a place in your life right now, well, that will be valuable to you. Let nothing stand in the way of you doing what's best for you and taking care of your mental health. Thank you.
right, thank you. Well, that was the last of our questions. Thank you both our panelists for the great information. We're going to open the floor for questions for any of us up here. If anybody has a question, just raise your hand.
Go ahead, Samantha.
Yes, ma'am.
So, I'm trying to put my business out, but this is real stuff. I'm experiencing what Cecilia was talking.
Okay.
I'm experiencing what Cecilia was talking about, this menopause stuff, because I just experienced constipation. I've never had that before.
Okay.
Experienced that. Got some other stuff that was going on that I was not aware of. You know, on like 80 plus days. You know what I'm saying? Like, it's up out of here, I think. So everything that you were saying, it's just like, oh my God, this is really happening.
Yeah.
So my question, what am I supposed to do?
Well, if you, I'm talking, I mean, she's close. So what I would say with that, so have you at least talked to your OB at all?
Okay, so I
about
don't
it?
have that appointment until December. I went
Okay.
to my primary the
Okay.
other day, just
Okay.
because I just couldn't wait till December.
Right.
You know what I'm saying? Because there was
Other things going on. So
So-
yeah, so I would say, if you definitely have OB/GYN appointment, I would say, definitely let them do your pelvic exam, tell them your symptoms first.
Okay.
And if they need to refer you out to a urogynecologist, they may do that
Okay.
because they can get a little bit more in depth of kind of all of the encompassing things. Now, your OB/GYN can start you on some things to kind of help.
Okay.
So until we can talk a little sidebar, we can get a little deeper into some of the symptoms.
Okay.
But, and I can tell you some things that they likely would do
Okay.
to try to help with that. But the general things like your constipation,
Mhm.
those things like that, you're just gonna have to incorporate some things like, really beefing up your fluids, getting on like stool softeners. It's a change. A lot of things are happening all at once. And you're going through it a little early because you're younger than me, right?
Yeah.
So you had a hysterectomy, but this is all
I
natural.
had
Myomectomy. Okay.
Yeah.
Yeah. So
In 08.
and some people will go through it a little bit earlier than others. So you're probably perimenopause. So they're gonna,
That's the word. That's the
Right.
word they use.
yeah. So you're perimenopause, but so you have your appointment, which is good because they're gonna need to do blood work on you.
Okay.
They're gonna need to do blood work and get your symptoms. You give them your history, what's going on,
Mhm.
and so that they can determine if you are
Actually,
in peri
because-
or full menopause.
Okay, because
Yeah.
she was saying it's things that she could do, but she didn't think it would really benefit me
Benefit
at
you.
the time. So she didn't do the check as far as the menopause stuff.
Right. So I would they need to do your blood work.
So she did blood.
She
okay,
did that?
Sorry,
Yeah.
y'all.
But we're gonna talk a little bit more, but you're on the right track, and we're gonna talk some more, and I'll tell you some things that just to advocate. But you're doing good because you need to be an advocate for it. Just like she said, advocate for things. If you know your body, you're going through changes.
Right. So that's what my mental health.
Yes.
Because I was just like, what's happening?
What's happening?
I'm gonna check out. Like, what's
Yes.
going on?
But lots of ladies, it's not just the ladies are going through it.
Okay.
Yeah. Yeah.
Any other questions?
Yes, maybe. Okay. Hi, I'm Raven. I have noticed that there are a lot of young ladies, like close to my age, because I just turned 30, and there are young women who are younger than me who are going through breast cancer now. And I am wondering if there's any programs or resources for young women who are worried, because I know that you mentioned that there is a way to kind of go around it since we can't get a mammogram until we're a little older, but I'm just wondering if there's any other resources for young women who are concerned about breast cancer, especially like those like me who have a family member, an aunt who died from breast cancer a few years ago, and my godmother, also a family member, who died from breast cancer. So, is there anything that we can recommend?
So there is, I can't remember if it's Young Breast Cancer Network or Young Survivors Coalition. I think it's Young Survivors Coalition. I'm not sure if the Columbia branch is still operating, But that is the thing. They do have a network or coalition for young breast cancer survivors. Since we always think about breast cancer in older women, the women that are diagnosed younger, which is happening more and more, kind of fall through the cracks for like emotional support, financial support, things like that. That'd be something to look into. And then again, as far as someone who, like in your case with the family history and things like that, but you're not in that bracket to get a mammogram yet, ask for additional clinical breast exams, ask for a breast ultrasound. They'll probably tell you to come back when you're 40, even if it's clear, but ask for another one. Just ask, because you do need to advocate for yourself, knowing like you have people around you. That kind of makes you more anxious about your health. You see people connected to you going through these things, like it kind of amps you up. So just get a peace of mind. I would talk to your provider personally about getting additional clinical breast exams, breast ultrasound, and just kind of talk about your concerns. Because like sometimes you go to the doctor and they're like, okay, why is this young lady coming in here? She's not this age. Advocate for yourself. Because not saying all providers are bad, but some of them do have implicit biases that they think some people are like psychosomatic. They're just making up these different symptoms, or they're worried because such and such has this going on. You know your body, your feelings are valid. So I would just continue advocating for yourself. And I'll look to see if it's the Young Survivors Coalition. I can't remember the name, but I don't know if our South Carolina branch is still operating, but there is a resource for younger women.
Thank you.
Any other questions?
Another question, but I guess you make a comment. Your body detoxing you when I was 34, lived in my gynecology, and he said I had a fibroid, and he said it was bigger than grapefruit. But this is what he told me. He said if they don't bother you, then you're okay. But then when he told me that, I said okay. I went to the phone because I was working at the hospital, and I called another gynecologist. And they gave me an appointment, and I went, and he said they need to come out. I mean, you don't need to have a fibroid piece of grapefruit and walking around with it. So I had my surgery, and when I was 34 years old, when I got, I guess 38 or 39, I found a breast lump a lump in my breast, and I stopped one of the surgeons. And he took it out, but he said it was benign. So you got to pay attention to your breath. You got to pay attention to your whole body. And it's okay to get a second opinion.
Yes, absolutely. Yeah, that's great. And that's just what is great to get second opinions. If you feel like your answers are not met, don't ever think that, you can't go and get that other opinion, because you have to be an advocate. Sometimes there is, like she said, there is implicit bias. But we would like your provider to definitely go, above those measures and really let you know your risk factors and really look into those things. And, sometimes doctors feel like, don't bother it if it's not, not bothering you. But a lot of times we end up finding that things such as, we could use the fibroids as examples. I get patients all the time, and then they're having these symptoms, and then I look and I said, "Oh, you have fibroids, and you coming in for urgency and frequency, and their bowels and all of these things." And I'm thinking, these are huge on the scan, and they're pressing into your bladder. This is likely what's causing it. We don't need to just throw this pill at you, because you don't need a pill. You need to have these removed, and likely your symptoms will go away. So when we deal with a lot of, throw medicines at things, a lot of times, if you just listen and get a good history, sometimes it's not medicine you need at all. It's some other intervention sometimes that will cure your problem.
Thank you for sharing that. Does anybody else have any other questions or comments or anything you would like to share? Yes.
So, Everett, I would like to say, especially in my age group and a little bit younger, I see a lot of butting of heads of opposite genders right now. And I think that's kind of sad, but for men who really want to be supportive, men who want to be there and things like that, I do see a lot of, butting of heads, different perspectives and things of that nature. But for those who, single, but they want to support the best way they can, coming out to events like this is definitely something that we can advocate for. What's some other things that single, married, or anything like that, men could assist in helping events like that.
I want to make sure I understand the question. I think it's good. What I'm hearing you say is that you're seeing a lot of butting heads between the genders, male versus female, masculine versus feminine, and all these things that we're hearing on social media and podcasts and things like that. But what I'm hearing is that you as a man, you would like to learn how to best support women's mental health or physical health issues. I think obviously just your level of awareness around the need for that support is really good. That you acknowledge that, yes, we need support, not just amongst each other as a sisterhood, but we also need our men to support us as well, and to be open to having uncomfortable conversations sometimes, and also being willing to listen. I think that's the biggest thing. And that's why we're seeing a lot of butting heads right now with genders. It's sort of this war of, between men and women that I'm seeing on social media, because I'm seeing a lack of listening. People are doing a lot of talking, but they're not listening. And it's not just listening, but listening for understanding. Listening to make sure you understand someone else's story, their perspective, their experience. And then the next step is to validate that. You saying, even if you don't agree with it, it's like, I can understand where you're coming from. I understand why you feel that way. Thank you for sharing that. And you'll be amazed at how much you can learn from someone if you just listen. And that is very powerful to the other person, because sometimes that's what they want. It's just someone to listen to them. They want to feel seen, they want to feel heard, and they want to feel validated. So do that, okay?
Great question. Great question.
I like that question. Also, I think another thing would be, don't ask, just do. If you see a woman that's going through something, don't ask, oh, what do you need? Because sometimes my answer is like, I don't know. I just need Jesus. I don't know. Like, so much going on. Like, please save me right now. But like sometimes, like you just do. Like for example, I knew I had to come to Columbia this weekend, but like I work full time and I'm getting my master's, so I forgot to get my oil change in my car, and I was like, I haven't done that in months. So my boyfriend was like, take my car, I'll get your oil change this morning. That was something I needed. I've been stressed. Like just instead of him like saying, what you gonna do? Why you get your oil change? He took the initiative. Sometimes he doesn't do that, but just take the initiative. Like if you see someone needing something, just do it. Don't ask them how or what in what way. Just do, because I'm sure that your help in some capacity is more than them just sitting there stressed out. And women also don't ask for help. Like I never ask for help. I'm a daddy's girl. I've been raised to be independent. Like, but sometimes I'm struggling. Like I'm struggling to keep up with just everyday life. So like when a man is like, or anybody comes in and just does something for me, or takes something off my task list so I can focus on myself or my work or my patient or whoever, like that's something how you can support women in general. Any more questions, comments? Oh, yes.
I have a comment. I could not get this minute distracted. Maybe I would like for you guys maybe next time to discuss a little bit more about how certain medications can relate to increased breast cancer incidence. For example, some of the ladies going through menopause, they might get put on estrogen or something to that effect, and long-term uses of the pill form or medication form that increase the incidence of breast cancer. The way I understand it, it's been a while since I've deal with all that. But then also your herbs and things like that. The side effects it might help this, but ladies should weigh the benefit versus the negative side of certain medications and herbs and how it can increase breast cancer and our tolerance from.
Absolutely.
Thank you. Yeah.
Yes, thank you for bringing that up.
Thank you.
Thank you. That was good. Thank you.
And thank you.
Any more questions, comments? Anybody?
Anybody else?
All right, well, thank you all so much for joining in and listening.
You ladies are amazing. We want to thank our panelists, our beautiful ladies, and we just know we added this was new this year, and it worked out really, really good. So thank y'all for coming through at the last minute. So we always, we really, really, really do appreciate it. And we thank all of you who stayed to listen and participate in our first Pink Table Talk. Next year, we'll know how to expand upon it, what to add to, take away. Our question is a question and add to, so we have some great points. We have some amazing questions and comments. So we just want to continue to thank you all for continuing to support us and support the cause that, we're doing this for. We just pray that we get bigger and better each year. Vets behind the camera.
Yes.
Yes. We pray that we continue to get bigger and better, and pray that we continue to keep you all our support. So thank y'all. This concludes our first ever Pink Table Talk at our Mimosas and Mammogram event. Thank y'all. Y'all enjoy the rest of the day.
Great. Thank you so much.